Hello everyone, Anita's here. Today I prepared a question for you, like a case study, and we're going to go through it together. And I also prepared a summarized chart about osteoporosis treatment. So we're going to review that together and we're going to conclude the correct answer. So here we have a patient, 65-year-old, a female diagnosed with osteoporosis. She's menopause and morbidly obese. BMI is 41, and there is moderate to severe renal impairment. Creatinine clearance is 37, and we're looking for the most appropriate treatment for her. So before we go through the answers, I just quick show you the summarized chart that I prepared for you. So above all, we have calcium and vitamin D. So they're going to be adjunct to each and every regimen, like no matter which treatment we choose for the patient, calcium and vitamin D is going to be on top of that all the time. So we have two categories. One is bone loss preventing agents, and the other one is bone firming agent, which is just one. So for the bone loss preventing agents, we have bisphosphonates, which are like the most popular one. We have alendronate, risedronate, etidronate, zoledronic acid. So the alendronate is used for both prevention and treatment. We have both daily and weekly preparations. For risedronate, we have daily, weekly, monthly. Etidronate is not a first line because it's a very weak agent, and also it comes in a pack of 90. Day 1 to 14 is etidronate, and day 15 to 90 is just supplemented with calcium. Zoledronic is intravenous yearly, which is a good option for people with GI side effects or people with adherence problems. So bisphosphonates decrease the risk of vertebral, non-vertebral, and hip fractures. So for each of these medications, we're going to review what the effects are. So let's just take a look at it here. Drug-drug interactions, anti-acids, biotrivalent cations, and NSAIDs because of increased risk of GI side effects. And contraindication is hypocalcemia and also creatinine clearance less than 35. Common side effects are GI side effects and also muscle pain or joint pain. Uncommon ones are ONJ and AFF, and the risk factor for osteonecrosis of jaw is high dose and also as well as poor oral hygiene. So for the other one, the risk factor is long duration treatment with bisphosphonates. Monitoring parameters is going to be bone mineral density, serum calcium, and serum vitamin D. Administration is, most of you, I'm pretty sure that you know, it should be at least 30 minutes before food and empty stomach, 4 to 8 ounce water, and also a patient must remain in upright position for at least 30 minutes. Also for the next one is the denosumab. It's RANK inhibitor, and it's drug of choice for people with chronic kidney disease, like creatinine clearance less than equal or less than 30, which is like a golden key here. So, and it's like a subcutaneous, and it's administered every 6 months. And the common side effect is increased risk of infection because it decreases the activity of T and B cells. Contraindication is hypocalcemia, and same as bisphosphonates, it decreases vertebral, non-vertebral, and hip fractures. The other one is the Rolloxed, which is selective estrogen receptor modulator. It has estrogen-like effect on bone and lipid profile, but it has anti-estrogenic effect on uterus and breast. And it's like a tablet every day, and it's also okay in renal impairment. The contraindication is any history of pulmonary embolism or DVT, also pregnancy lactation. Side effects will be thromboembolism and hot flashes. And because of that, we're not gonna initiate Rolloxed in women that are not still established with their menopause. The next one will be hormone therapy, which is for women only, and it's going to be estrogen plus minus progesterone, depending on the status of uterus, whether they had done hysterectomy or they have intact uterus. One thing about hormone therapy is that we are never going to give hormone therapy for osteoporosis alone. It should be always accompanied by vasomotor symptoms, so we could kind of dual target both problems at the same time, but it's not going to be hormone therapy only. And contraindications can be like just like any other hormone therapy, like I'm pretty sure that you remember from contraception. So DVT, any hormone-dependent breast cancer, like people that are morbidly obese, and also like just same as denosumab and bisphosphonates, it decreases the risk of vertebral, non-vertebral, and hip fractures. Calcitonin, it's not approved for osteoporosis. It's just okay for short-term fracture pain, and it's subcutaneous, and it only affects vertebral risk reduction. Storage, the injectable should be in fridge, and nasal spray also in fridge until opened, and after that, room temperature is fine for 30 days. After that, discard. Then we get to the other category, bone forming agent, which is Teraperitide. It's a recombinant human parathyroid hormone. So it's just has the same effect as PT, like naturally occurring PTH, that it increases calcium reabsorption in kidneys, and also it stimulates osteoblasts. It's used for severe and refractory osteoporosis, and it's subcutaneously in thigh or abdomen tissues, and the monitoring parameters are same as bisphosphonates, and it also affects vertebral, non-vertebral, but not hip, and should be stored in fridge. One important thing here is that the maximum exposure with Teraperitide is 2 years. No one can use Teraperitide for more than 2 years in their lifetime. So that's one more thing that I want you to keep in mind. So get back to our question here. So the first option, Rolloxed. So here, by just taking a look, patient is morbidly obese. So Rolloxed is out because of thromboembolism risk. ST2RNA, earlier I mentioned, it's not a first line anyways because it's a very weak agent. Denosumab, we get to that one later. Hormone therapy, just as I said here, I know that the patient is menopause, but there's nothing mentioned about vasomotor symptoms, so we're not gonna give hormone therapy for solely osteoporosis. So we're just left with denosumab. That's the best option in here. We're just going to highlight that. Yeah, amazing. I hope you enjoyed this video and you actually learned something. Good luck, guys, and talk to you soon.